Welcome to today's Mental Health Nursing Nclex Challenge. In this video, you're going to face 50 high-level exam-style questions designed to sharpen your psychiatric nursing knowledge, strengthen your clinical judgment, and prepare you for the exact level of difficulty you'll see on the real Nclex. These questions cover therapeutic communication, crisis intervention, psychopharmacology, schizophrenia, mood disorders, personality disorders, substance use, safety, prioritization, and more, the full spectrum of mental health nursing. Every question includes clear rationales and strategies helping you understand why an answer is correct and how to think like an NCLEX-ready nurse. So take out your notes, stay focused, and make sure you watch till the end. Your score will tell you exactly where you stand. Let's begin.
Question 1. A client with schizophrenia states, "The television is sending me secret messages." What is the most therapeutic response? A. That's impossible. The TV cannot talk. B. Tell me more about what you're hearing from the TV. C. Let's change the subject so you can relax. D. Why do you think the TV is sending messages? Correct answer, B. Tell me more about what you're hearing from the TV. Rationale encourages expression without validating delusions. Strategy: acknowledge feelings, not the delusion. Explore safely. Question 2. A client with major depression says, "I don't want to live anymore." What should the nurse do first? A. Distract the client with activity. B. Encourage journaling. C. Ask directly if the client has a plan to kill themselves. D. Notify the family immediately. Correct answer, C. Ask directly if the client has a plan to kill themselves. Rationale: priority is suicide risk assessment. Strategy: direct suicide assessment is always first. Question 3. A manic client is hyperactive, intrusive, and refusing meals. What is the priority nursing action? A. Explain unit rules firmly. B. Encourage participation in group therapy. C. Provide high-calorie finger foods. D. Offer detailed education about nutrition. Correct answer, C. Provide high-calorie finger foods. Rationale: mania causes high activity and poor intake. Nutrition is priority. Strategy: meet basic physiological needs first. Question 4. A client with command hallucinations states, "The voices are telling me to hurt someone." What is the priority action? A. Encourage the client to ignore the voices. B. Provide headphones to block noise. C. Offer PRN antipsychotic medication. D. Assess who the client is being told to harm. Correct answer, D. Assess who the client is being told to harm. Rationale: determine the level of danger to self or others. Strategy: command hallucinations, assess content immediately. Question 5. A client with alcohol withdrawal has tremors, agitation, and hypertension. Which medication is expected? A. Haloperidol. B. Lorazepam. C. Sertraline. D. Lithium. Correct answer, B. Lorazepam. Rationale: benzodiazepines prevent seizures and reduce withdrawal symptoms. Strategy: alcohol withdrawal, benzodiazepines first line.
Question 6. A client with PTSD reports frequent nightmares interfering with sleep. Which prescription is expected? A. Fluoxetine. B. Olanzapine. C. Prazosin. D. Propranolol. Correct answer, C. Prazosin. Rationale: prazosin reduces trauma-related nightmares. Strategy: no key PTSD medications. Question 7. A paranoid client refuses food, stating, "You are trying to poison me." What is the best response? A. Force the client to eat. B. Offer sealed prepackaged food options. C. Ask the client why they believe that. D. Tell the client the belief is irrational. Correct answer: B. Offer sealed prepackaged food options. Rationale: builds trust and decreases suspicion. Strategy: paranoia to enhance sense of safety. Question 8. A depressed client suddenly becomes cheerful after weeks of withdrawal. What is the nurse's priority? A. Praise the improvement. B. Assess for suicidal intent. C. Encourage social interaction. D. Reduce observation level. Correct answer: B. Assess for suicidal intent. Rationale: sudden improvement can indicate a suicide plan. Strategy: be alert for subtle suicide warning signs. Question 9. An OCD client washes hands for hours at a time. What is the first intervention? A. Tell the client to stop washing. B. Explore the reason behind the ritual. C. Allow the behavior initially, then gradually set limits. D. Restrict access to the sink. Correct answer: C. Allow the behavior initially, then gradually set limits. Rationale: sudden interruption increases anxiety. Strategy: OCD to gradual limit setting. Question 10. A schizophrenic client reports hearing voices saying, "You are worthless." What is the most therapeutic response? A. You should ignore those voices. B. I don't hear the voices, but I know they sound real to you. C. Those voices aren't real. D. Why are you listening to them? Correct answer: B. I don't hear the voices, but I know they sound real to you. Rationale: acknowledge feelings, not hallucinations.
Question 11. A client with bipolar disorder is loudly interrupting group therapy. What should the nurse do? A. Tell the client they are being rude. B. Allow them to continue so they feel included. C. Remove the client from group and redirect to a calm environment. D. Ask the group to ignore the behavior. Correct answer: C. Remove the client from group and redirect to a calm environment. Rationale: hyperactivity disrupts group. Reduce stimuli. Strategy: mania, low stimulation. Question 12. A client with anorexia nervosa refuses to eat breakfast. Which action is best initially? A. Force the client to eat. B. Offer choices within the meal plan to promote control. C. Ask why eating is difficult. D. Allow the client to skip the meal. Correct answer: B. Offer choices within the meal plan to promote control. Rationale: provides autonomy while maintaining treatment plan. Strategy: eating disorders, promote control safely. Question 13. A client with generalized anxiety disorder complains of constant worry. What is the most effective immediate intervention? A. Explore childhood experiences. B. Teach deep breathing and grounding techniques. C. Encourage journaling. D. Recommend long-term psychotherapy. Correct answer: B. Teach deep breathing and grounding techniques. Rationale: reduces acute anxiety quickly. Strategy: immediate relaxation techniques. Question 14. A client with dementia becomes agitated during bathing. What action is most appropriate? A. Scold the client for resisting care. B. Give detailed verbal instructions. C. Use calm reassurance and simplify the task. D. Restrain the client to finish quickly. Correct answer, C. Use calm reassurance and simplify the task. Rationale: dementia patients respond to calm, simple cues. Strategy: reduce triggers, use simple steps. Question 15. A client with borderline personality disorder threatens self-harm when limits are enforced. Which action is correct? A. Remove all limits. B. Ignore the threats. C. Maintain limits and ensure constant observation. D. Negotiate new rules. Correct answer, C. Maintain limits and ensure constant observation. Rationale: consistent structure plus safety monitoring. Strategy: personality disorders, firm, consistent boundaries.
Question 16. A client with schizophrenia is standing still and not blinking for long periods. The nurse recognizes this as echolalia, neologisms, catatonia, flight of ideas. C. Catatonia. Rationale: catatonia involves immobility, staring, and lack of movement. Strategy: no hallmark symptom clusters of psychotic disorders. Question 17. The nurse is caring for a client with narcissistic personality disorder. Which behavior is most expected? Extreme submissiveness, grandiosity and need for admiration, severe social anxiety, or disorganized speech? B. Grandiosity and need for admiration. Rationale: narcissistic traits include exaggerated self-importance. Strategy: match personality disorders with defining features. Question 18. A client taking clozapine reports fever and sore throat. What should the nurse do first? Encourage fluids? Give antipyretics? Notify the provider immediately? Or reassure the client? C. Notify the provider immediately. Rationale: signs suggest agranulocytosis, life-threatening. Strategy: clozapine, monitor WBC, fever equals emergency. Question 19. A client with panic disorder is hyperventilating. What is the first nursing action? Give benzodiazepines? Guide the client to slow their breathing? Provide detailed explanations? Or leave the client alone for privacy? B. Guide the client to slow their breathing. Rationale: breathing control reduces physiological panic symptoms. Strategy: manage airway and breathing in panic attacks. Question 20. A client with depression refuses morning medications. What is the best initial response? Threaten consequences? Explore the client's reason for refusing? Offer a sedative instead? Or ignore the refusal? B. Explore the client's reason for refusing. Rationale: understanding motivations guides intervention. Strategy: use therapeutic communication first.
Question 21. A client in the psychiatric unit reports, "I feel like I'm floating outside my body." The nurse identifies this as A. Hallucination. B. Dissociation. C. Illusion. D. Delusion. Correct answer, B. Dissociation. Rationale: dissociation involves detachment from self or surroundings. Strategy: recognize trauma-related dissociative symptoms. Question 22. A client with schizophrenia shows poor hygiene and apathy. These symptoms are A. Positive, B. Cognitive, C. Negative, D. Neurological. Correct answer, C. Negative. Rationale: negative symptoms include flat affect, apathy, lack of motivation. Strategy:
Distinguish positive versus negative schizophrenia symptoms. Question 23. A client taking lithium is vomiting and has severe diarrhea. What should the nurse do? A. Administer another lithium dose. B. Reassure the client. C. Offer antidiarrheal medication. D. Hold lithium and notify provider. Correct answer, D. Hold lithium and notify provider. Rationale, GI symptoms indicate early lithium toxicity. Strategy, know lithium toxicity signs and interventions. Question 24. A newly admitted suicidal client is calm and cooperative. Which order should the nurse question? A. 1-to-1 observation. B. Removal of dangerous objects. C. Q15-minute checks. D. Psychiatric evaluation. Correct answer, C. Q15-minute checks. Rationale, high-risk clients require constant observation, not Q15. Strategy, safety overrides all in suicidal clients. Question 25. A client with Alzheimer's repeatedly asks, "Where am I?" What is the best nursing response? A. You already asked me that. B. You're in the hospital. You're safe here. C. Try to remember. D. Ignore the question. Correct answer is B. You're in the hospital. You're safe here. Rationale. Provides orientation and reassurance. Strategy. Use simple, repeated reassurance in dementia. Question 26. A client with bipolar disorder is started on valproate. What lab should be monitored? A. TSH. B. Liver function tests. C. BUN. D. Lithium level. The correct answer is B. Liver function tests. Rationale. Valproate can cause hepatotoxicity. Strategy. No adverse effect of mood stabilizers. Question 27. A schizophrenic client mutters continuously and is unable to focus. This is A. Word salad. B. Preservation. C. Thought blocking. D. Clang association. The correct answer is C. Thought blocking. Rationale. Sudden interruptions of speech are hallmark of thought blocking. Strategy. Identify speech pattern disturbances. Question 28. A client in acute mania is becoming aggressive. What is the priority action? A. Teach coping skills. B. Ensure the client has a safe environment. C. Offer snacks. D. Encourage group therapy. The correct answer is B. Ensure the client has a safe environment. Rationale. Safety is always the priority with aggression. Strategy. Prevent escalation and injury. Question 29. A client experiencing severe anxiety says, "I can't breathe." What is the nurse's first action? A. Explain physiology. B. Leave the client to calm down. C. Stay with the client and speak calmly. D. Administer antipsychotics. Correct answer is C. Stay with the client and speak calmly. Rationale. Presence and calm communication reduce anxiety. Strategy. Severe anxiety equals stay, reassure, slow breathing. Question 30. A teen with anorexia nervosa has a BMI of 14. What is the priority? A. Discuss body image. B. Initiate nutritional rehabilitation. C. Encourage journaling. D. Provide family therapy. Correct answer, B. Initiate nutritional rehabilitation. Rationale, BMI this low indicates medical instability. Strategy, physiological stabilization always comes first.
Question 31. A client with antisocial personality disorder violates unit rules repeatedly. What is the best response? A. Negotiate new rules. B. Enforce consistent consequences. C. Ignore minor violations. D. Provide excessive praise. Correct answer is B. Enforce consistent consequences. Rationale. Firm, consistent limit setting reduces manipulation. Strategy. Antisocial traits imply consistency and structure. Question 32. A client on haloperidol develops muscle rigidity and high fever. The nurse suspects A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Tardive dyskinesia. D. Dystonia. Correct answer is B. Neuroleptic malignant syndrome. Rationale. NMS includes rigidity, fever, and autonomic instability. Strategy. Stop antipsychotic and notify provider. Question 33. A client with PTSD avoids crowded places. This behavior is known as A. Flashbacks. B. Avoidance. C. Hyperarousal. D. Dissociation. Correct answer is B. Avoidance. Rationale. Avoidance is a core PTSD symptom. Strategy. No symptom clusters of PTSD. Question 34. A client taking SSRIs reports sexual dysfunction. What is the best nursing intervention? A. Stop the medication. B. Ignore the complaint. C. Discuss possible medication adjustment with provider. D. Tell the client it's normal and unavoidable. Correct answer is C. Discuss possible medication adjustment with provider. Rationale. SSRIs commonly cause this. Dose or drug changes may help. Strategy. Collaborate with provider for symptom management.
Question 35. A client with schizophrenia refuses to bathe. What is the best approach? A. Force the client to shower. B. Offer step-by-step simple instructions and assistance. C. Ignore hygiene needs. D. Ask the client why they refuse. Correct answer, B. Offer step-by-step simple instructions and assistance. Rationale. Disorganized thinking requires simple structure. Strategy. Simplify tasks for cognitive deficits. Question 36. A client with anxiety asks repeatedly if they're safe. The best nursing response is A. Stop asking the same question. B. You are safe here. I'm here with you. C. Try to remember where you are. D. Calm down so I can help you. Correct answer, B. You are safe here. I am here with you. Rationale. Reassurance is therapeutic in anxiety. Strategy. Use calm, supportive statements. Question 37. A client taking MAOIs wants to eat aged cheese. The nurse should A. Allow. B. Allow in small amounts. C. Teach that tyramine foods can cause hypertensive crisis. D. Encourage eating it with milk. Correct answer, C. Teach that tyramine foods can cause hypertensive crisis. Rationale. MAOIs require dietary restrictions. Strategy. Memorize MAOI food interactions. Question 38. A client with schizophrenia asks for aluminum foil to shield the brain. What is the best response? A. Give the foil. B. Acknowledge the fear and redirect to a safe activity. C. Argue that shielding is unnecessary. D. Laugh to ease tension. Correct answer, acknowledge the fear and redirect to a safe activity. Rationale, avoid reinforcing delusions. Redirect. Strategy, safety plus redirection is key. Question 39. A client with OCD must check the door 30 times before bed. Which intervention is best? A. Tell them to stop immediately. B. Gradually reduce the time spent checking. C. Allow unlimited checking. D. Encourage avoidance of doors. Correct answer, B. Gradually reduce the time spent checking. Rationale, exposure and response prevention reduces compulsions. Strategy, gradual change, never abrupt. Question 40. A depressed client refuses to get out of bed. What should the nurse do first? A. Give the client privacy. B. Assist the client with small, simple tasks. C. Encourage journaling. D. Provide lengthy education. Correct answer, B. Assist the client with small, simple tasks. Rationale, depression reduces motivation. Support ADLs. Strategy, set achievable goals. Question 41. A client on risperidone develops breast enlargement. This is due to A. Liver toxicity. B. Increased prolactin. C. Low dopamine. D. High serotonin. Correct answer, B. Increased prolactin. Rationale. Risperidone increases prolactin levels. Strategy. No hormonal effects of antipsychotics. Question 42. A client with conversion disorder suddenly becomes unable to walk. Priority nursing action. A. Confront the client. B. Assess for underlying stressor. C. Force ambulation. D. Apply restraints. Correct answer, B. Assess for underlying stressor. Rationale, symptoms are related to psychological conflict. Strategy, address emotional needs, not physical punishment. Question 43. A client with depression states it's hopeless. What is the best response? A. You shouldn't feel that way. B. Tell me what feels hopeless to you. C. It will get better. D. Avoid responding. Correct answer, B. Tell me what feels hopeless to you. Rationale. Encourages expression and assessment. Strategy. Use open-ended questions. Question 44. A bipolar client is started on lamotrigine. Which finding is most concerning? A. Nausea. B. Headache. C. Rash. D. Fatigue. Correct answer, C. Rash. Rationale? Rash may indicate Stevens-Johnson syndrome. Strategy? Recognize serious skin reactions. Question 45. A client with schizophrenia is responding to internal stimuli. What should the nurse do? A. Ask them to stop hallucinating. B.
encourage them to participate in reality-based activity. C, validate the hallucinations. D, leave them alone. Correct answer, B, encourage them to participate in reality-based activity. Rationale, reality-based engagement reduces hallucinations. Strategy, encourage grounding in reality.
Question 46. A patient with anxiety requests medication for sleeping. Which medication is most appropriate short-term? A, fluoxetine. B, lorazepam. C, clozapine. D, lithium. Correct answer, B, lorazepam. Rationale. Benzodiazepines treat acute anxiety/sleep issues short-term. Strategy. Use benzos briefly due to dependence risk. Question 47. A client with schizophrenia shows fixed false beliefs despite evidence. This is A, hallucination. B, delusion. C, illusion. D, confabulation. Correct answer, B, delusion. Rationale. Delusions are false, fixed beliefs. Strategy. Recognize key vocabulary word. Question 48. A client with dementia becomes more confused at night. This is known as A, confabulation. B, remote memory loss. C, sundowning. D, hallucination. Correct answer, C, sundowning. Rationale. Evening confusion is typical in dementia. Strategy. Provide calm nighttime routine. Question 49. A client on ECT prepares for their first treatment. Which statement shows need for teaching? A, I won't feel anything during the procedure. B, I might be confused afterward. C, I will stay awake during the shock. D, I may have short-term memory loss. Correct answer, C, I will stay awake during the shock. Rationale. ECT uses anesthesia and muscle relaxants. Strategy. Clarify common misconceptions. Question 50. A client with schizophrenia takes haloperidol and begins pacing, restless, and unable to sit still. This is A, dystonia. B, tardive dyskinesia. C, akathisia. D, neuroleptic malignant syndrome. Correct answer, C, akathisia. Rationale. Akathisia causes motor restlessness. Strategy. EPS symptoms must be recognized early. Great job completing all 50 mental health nursing Nclex questions. If you were able to follow the rationales and apply the strategies, you are already developing the critical thinking skills needed to pass the Nclex with confidence. Make sure you review the questions you missed, write down the rationales that challenged you, and continue practicing consistently. If you want more high-level Nclex videos like this, let me know the topic you want me to cover next. Thank you for watching. Keep studying, keep practicing, and I'll see you in the next session.